So the next one that we are going to talk about is oxytocin. It's on page 782 in the Lenny's textbook of ours. So it's a hormone produced in the posterior pituitary. We already know that. And so the way it acts on the body is the way the drug's going to act too. It's just going to increase that effect. So the indications to promote those uterine contractions, the milk ejection is how it works on the body, but it's going to increase that force, that frequency, and duration of that contraction. So the primary use is used for that induction of labor or augmentation of labor. Induction just means to start it. Augmentation means if it's stopped, then restart it. All right, so this is available as an IM and IV. The pregnancy beyond the term, it's used for pregnancy beyond term or pregnancy that early the vaginal delivery would be likely. If you think that it would be less morbidity and mortality risk C-section, then this would not be used. All right, so there's too many qualities that we should be looking for as nurses. We're going to be looking if the lungs are matured yet and if the cervix is right. So if the lungs are not mature, we don't want to start that right away. We're going to have to give them a glucocorticoid to speed up that the fetus development of that maturation of the lungs before we can get them out. The second thing is our cervix ripe. They use a Bishop scoring system, which is going to measure for 4 different things. We're going to be looking at the diameter of our cervix, which in normal pregnancy, we're looking at like 3 to 5 centimeters. So I don't know how much it is in the normal pregnancy, but we're looking at that diameter. The position, is it posterior, anterior, or is it the mid area, depending on how close it is to the entrance of basically the vagina area. All right, the station of the head, is it engaged in the pelvis? Is it away? If it's away, it's negative. If it's closer to the entrance, it's positive. If the head is like hanging out, then that's like a +5, for instance. Okay. The dilation toward labor, oftentimes the cervix is dilated, but if it's not some patients have had non-dilated and still went into labor, so it's not the best determining, but all these factors determine, is your cervix ripe? Are we going to induce that labor? Are we going to make this choice or not? That's what it comes down to. So the main risk to watch for, and I'm going to say this twice, uterine rupture, intrauterine rupture. That is the scariest thing. So that's the thing that we're going to watch for, because that is when it's contracting so hard, it can actually rupture it. All right. So it's contraindicated. Anything that requires a C-section is contraindicated. For pelvic disproportion, fetal malpresentation, placental abnormalities, and umbilical prolapse, previous uterine surgery, fetal distress, presence of active genital herpes. Anything that's contraindicates to go through the normal delivery labor process of the natural way that requires the C-section, we're not going to be giving them this because they're going to be more of a candidate for surgery, will increase the likelihood of not mortality, basically. Or I mean, not mortality, mortality. All right. So for induction of labor, we want to administer this actually as an IV. So I know I said it was an IM and IV, but as the induction of labor, they use it as an IV and they infuse it. They determine it, they titrate it up. So they infuse, and the flow rate depends on the uterine effect. So depending on how the pregnant mother reacts will determine that how much needs to be elevated as it goes up. So you start low and you go up. And so the nurse and the doctors will be monitoring the fetal constantly. So this is the most important thing. So how do we know if we needed to stop this medication of oxytocin immediately? So here's the things. The elevation of resting uterine pressure, if it's above 15 to 20 mmHg, if it's above that, stop immediately. If the contractions are lasting longer than 1 minute, stop. If the contractions are happening more often than 2 to 3 minutes each, like there's more than one contraction within the 2 to 3 minute bracket, stop. If there's a pronounced fetal heart rate and rhythm alteration, we need to stop immediately. So these are the 4 main things that we're looking for to stop that medication, because it can be very deadly. Also, just a side note is that it acts like ADH, which is our antidiuretic hormone. So it will make oxytocin can make you retain more water. So if you're giving fluid electrolytes to the mother at the same time, they can be you got to watch for that fluid electrolyte overload. So the mother, you're going to be wanting to monitor her blood pressure, their pulse rate, and also their uterine contractions, because every time it contracts, the reason that you don't want it to be lasting longer than 1 minute or more often than 2 to 3 minutes is because if they're contracting, basically the baby is not getting oxygen during that time. You need to have those natural rests in order to allow the baby to get that oxygen, or else they're going to become hypoxic. So for the baby, we're going to be looking at their heart rate and their rhythm. And so that's everything about oxytocin that is like the must knows.